Good afternoon. I'm Monica Hendrickson, Public Health Administrator for Peoria City County Health Department, and welcome to our COVID briefing. It has been a while since we've actually had a COVID briefing, which I think is actually good news, and would just appreciate also that our media partners were able to reschedule for us to be able to touch base and kind of give an update about where we have been in a little bit over a month now in terms of our last discussion. So as of Friday, April 8th, the Tri-County currently has 93,380 cases to date. That includes Peoria County at 46,779, Tazewell County at 36,136, and Woodford County at 10,465. Sadly, we report over 1,140 deaths in the Tri-County, which includes 564 Peoria County residents to date, Tazewell County at 446, and Woodford County at 135. Some of the good news we've seen since the changes that happened in February, as well as the continuing monitoring, is that our Tri-County now only is averaging 24 new cases each day, and Peoria County is averaging 13 new cases each day. Now, we recognize that the data from these numbers is an underestimate because of testing capacity available through at-home testing. But even more so, when you look at Peoria County residents specifically, there are currently only 104 active cases in Peoria County. That includes 98 individuals at home and isolating, but more importantly, only 6 Peoria County residents are currently hospitalized. Speaking of hospitalizations, OSF St. Francis Medical Center, Unity Point Health, Proctor, Methodist, and Pekin currently are reporting 8 ICU beds in use and 20 non-ICU beds in use for COVID-19. They also report 2 deaths in the past 24 hours. We do expect OSF St. Francis and Unity Point Health to continue to have ICU capacity related to COVID-19 as well as non, and that again is because they are a regional hospital and they draw from a larger area. But the fact that our own residents only number 6 current hospitalizations is a great sign. Since we last spoke, a couple of things. There has been changes to our testing options in our community. While the site at the Civic Center is no longer available, there is still availability through our local pharmacy programs such as Walgreens and CVS, along with, depending on your symptoms, you will still be tested at any of the 2 healthcare systems as well as Heartland Health Services. But more importantly, you can always access over-the-counter testing. If for any reason you are feeling symptomatic, especially now where we are seeing also our high levels of influenza kind of mirror the same path, take advantage of the at-home testing and pick up a test kit through our pharmacies, or you can still access your free kits through the federal government. There is a lot of questions that we've received regarding vaccinations, especially this idea of the next booster, your second booster, to talk more about not only the booster system as well as the new type of variant that is also being monitored. We have Dr. Ahmad, infectious disease specialist from the University of Illinois College of Medicine, Peoria.
Hello, I'm Dr. Ahmad. I'm one of the infectious disease specialists working with the University of Illinois College of Medicine, and I'm a staff physician at OSF St. Francis. So I'll talk briefly about this, the second boosters, which were recently approved. So on March 29, 2022, FDA amended the emergency use authorization for both the Pfizer and the Moderna vaccinations for a second booster. So I'll try to keep it simple. So if you're above the age of 50 and you've had the first booster, you can get a second booster dose with either Pfizer or Moderna vaccine at least 4 months after your first booster dose. So above the age of 50, either of those vaccinations can be used. If you're above the age of 12 years old and you have an immunocompromised state, for example, people who've had solid organ transplant or other conditions which make them immunocompromised at the same level, then age 12 and above, you can get the second booster with the Pfizer and BioNTech vaccine at least 4 months after your first booster. If you're above the age of 18, then you can use the Moderna vaccine, the same regimen. So at least 4 months after your first one, and age above 18 with the same kind of immunocompromised state. So the difference between the Pfizer and the Moderna vaccine in this case of the second booster is the age. Age 12 and above, Pfizer. Age 18 and above is Moderna, if you have an immunocompromised state. If you're above the age of 50, then you can use either Pfizer or Moderna. So these recommendations are kind of now more like you can decide your individual risk, what you have, look at your own comorbids, and then decide if you want to have these boosters. The amended authorization is based on a summary of surveillance data provided to the FDA by the Ministry of Health of Israel, where they administered about 700,000 second booster doses of Pfizer and Pfizer BioNTech COVID vaccine at least 4 months after the third dose in adults age 18 and older. Out of these 700,000, 600,000 were 60 years of age or older. For the Moderna, they kind of extrapolated this experience from the Pfizer vaccine and from an independently conducted study of about 120 participants age 18 and older with the booster 4 months after your last booster, and they found that there was no big safety concerns. And then there was another open label trial in Israel where they looked at Pfizer or Moderna in about 154 individuals, and they found that having these second booster increased the level of neutralizing antibodies against COVID, against Delta and Omicron variants, compared to just having one booster. So roughly 3% of the US population is considered immunocompromised and is already eligible for a fourth dose, but this is again grouped with very specific medical conditions like cancer or organ transplant. This does not include the 54 million adults over 65. So at this point, the summary is, if you're above the age of 50, again, you can look at your own individual risk, look at your own medical comorbidities, and then decide if you want to have the booster. Obviously, the older you are, the more medical issues you have, and especially if you're immunocompromised, you may want to consider the second booster. And for people less than age of 50, so if you're above the age of 12, you can consider a Pfizer second booster. Above the age of 18 is Moderna booster. And again, I think for the most part, they have left it to the individuals to make that choice. We have to remember these vaccinations, even with the first 3 doses, they're very effective at preventing you from getting moderate to severe disease. Severe enough it definitely still provides you very effective protection against severe disease, hospitalization, and death. Yes, with the emergence of new variants, we found that these vaccines were less effective compared to the wild strain in preventing transmission of even mild disease, but overall, these vaccinations are still very, very effective in preventing severe disease. So at this point, my message is going to be look at your own history, look at what risk category you fall in, look at your own individual risk, what kind of activities you're engaging in, and then decide if a second booster is right for you. I'll also cover the Micron BA2, which is this is a subvariant which has become the dominant form of COVID around the world, and this was declared on March 22nd by World Health Organization. It exploded across Africa, Europe, and Asia, and now it's about 55% of all new COVID infections in the US. So in the most likely scenario, what the scientists have postulated that these variants, so the BA1, which was the original Omicron variant, BA2, the new subvariant, and there might have been a third one, BA3, which evolved. The BA3 evolved, but it never took off. It probably evolved over the course of chronic infections in a small population of immunocompromised people, kind of bouncing back and forth between members of this population. It kind of provided like a training ground for this virus, allowing the virus to kind of probe and test for new mutations, which allowed it to spread more effectively. So with BA1, the original Omicron, there were about 60 mutations, which were not found in the original ancestral COVID strain. But it had 32 mutations on the spike protein, which is the target for immune cells and vaccines. The subvariant of BA2 is similar to BA1, but it has 28 unique genetic changes of its own, with 4 of them in that spike protein. So this is like, Omicron was the first variant to evolve in the context of mounting immunity in the population as a result of vaccines and prior infections. The good thing so far is that evidence indicates that the disease caused by BA2 is not likely to be more severe than those caused by BA1 in vaccinated people or in people who were previously infected with COVID. So can you get BA2 infection after BA1? It's extremely rare, but it can happen. But in all likelihood, if you've had BA1, you're probably well protected from BA2. So what the scientists are anticipating that where BA1 has already peaked at high levels, we may not see a lot of big surges of BA2. Example is in South Africa, where they had the huge Omicron wave in December, and then the BA2 in the country is not that much of a problem right now. There are other factors which will probably govern BA2's transmission: vaccine and booster coverage, public health countermeasures, and the average age of population. For example, in Hong Kong, the dramatic surge in COVID over there has been attributed in part to vaccine hesitancy amongst the elderly. So I would say if the succession of ever more transmissible variants has any silver lining, it is that they are evolving in tandem with your population immunity. So every new variant may cause fewer deaths simply because more people are able to thwart infection and severe disease because of prior vaccination and natural immunity. But we also have to keep in mind that COVID is also more liable to change than any other respiratory viruses we have learned to live with. So while the transmissibility may eventually hit a plateau, we don't know how things would be, in a few years from now. So I'm cautiously optimistic about this, but yeah, I think we still can't let go of our basic safety measures. The symptoms of BA2 are going to be the same as your regular Omicron. The preferred drugs for all Omicron variants are the remdesivir, intravenous, Paxlovid, which is the oral COVID drug, and then there is a new monoclonal antibody, bebtelovimab. One thing which is new, which has happened, is that the old monoclonal antibody, sotrovimab, which was around, has now been, the US health officials have stopped the further deployment of this antibody in places where the subvariant is now causing the majority of infections, because this old antibody, sotrovimab, does not work effectively against the subvariant. This is kind of similar to when we had the Omicron coming in and they had the old antibodies from Lilly and Regeneron, and they were withdrawn from the market, which were not very effective. But overall, yes, the treatment regimen for the most part for the subvariant are going to be more or less the same as what we've been using over the last year and a half. So I'm going to end over this, and if you have any questions.
Thank you, Dr. Ahmad. I'll open up from questions from our media partners.
Is there any kind of update on vaccines for the under 5 population at this point?
We're anticipating that it is still in process going through the FDA and the CDC approval system. We had originally thought, a few months ago we'd see it. April was another timeline. I think it's still further pushed back. We're also looking late April into early May. But I think what's really key that Dr. Ahmad spoke to is when we talk about personal choice, we really are focusing on that second booster. But overall, vaccinations are going to still be primary for if you have not been vaccinated or you've not received your first booster, to make sure you do go and take those on. It's really where we come into the additional second dose that there is flexibility based on your own health history. But the original series plus the booster is still going to be imperative for us to maintain ourselves ahead at this pace where, again, we're seeing only 13 new cases a day in Peoria County.
It's so low right now. Do we see COVID becoming a seasonal thing? I mean, it probably will continue to fluctuate, but will we eventually see it go back up in wintertime or fall?
So the question is whether we will see COVID be seasonal. And in fact, COVID or coronaviruses in general are seasonal. So they're going to kind of follow the same pathways we see with other respiratory health issues. So again, especially in the Midwest on a beautiful snowy day in April, you come in together in colder seasons, you go out so you can see how different transmission types happen based on our own behavior. So there is a seasonality. So we do expect COVID cases to kind of mirror that. We've seen it, and sadly, the past 2 years of monitoring this. But in terms of vaccinations, and will this become similar to influenza, where we'll have an annual vaccine or an annual booster, that is still yet to be determined.
I understand recently there were some changes with the federal COVID money, so some of that aid has run out. How's that affecting us here in Peoria?
So, we are very much interested in how the federal funds come through because it sustains our public health infrastructure, especially in the surge capacity that we're in. We have funding locally for us to continue the work in terms of monitoring the disease surveillance, as well as assisting with testing and vaccination clinics throughout the end of the year. But I think what we're all kind of, trying to look at our magic ball to see is what does 2023 look like? If we start seeing similar to the surge we saw this December and into January, there will be a need for additional support in 2023. So these dollars, as well as they are an influx for the response, I think it's also important to understand that before COVID-19, public health infrastructure, which is a safety net in a community, was very much underfunded. So a lot of the funding we saw actually brought public health to current levels as a public safety entity. And so when you start cutting it, you're kind of receding back the good work that rebuilt the surveillance system, a monitoring system, so that we could quickly respond rather than spending a large portion of our response time trying to build up capacity. It was already in existence.
So do you think that the pandemic has changed kind of the mindset on how we need to fund public health, or hopefully it'll stay this way and not go back?
I do hope that the pandemic, if their silver linings exist, does reinforce the value of public health in communities, especially locally, and would love to make sure that our federal partners and our state partners, again, fund our programs. Local health departments in the state of Illinois did not see increases almost for over 20 years, and they only saw 2 increases in that time period, and I think it was a total of just adding $4 million to 102 counties' budgets. So you can imagine that this surge that we saw was fantastic and needed, but we'd like to see it sustained in some form or fashion.
Over the past month since the last COVID briefing, does it seem like vaccines are still sought out by people who haven't gotten them yet?
In terms of vaccinations, I think what we're seeing now is actually the second round of boosters that people are interested in. I think we've seen the capacity for first doses until we see younger age ranges possibly now be qualified. But I think we're right now in 2 different booster groups. I think we are for children that have received their first series, and now, thinking about those that might be looking or needing to have another booster because of their being immunocompromised or having health conditions, and then that second booster shot. I will say for the Peoria City County Health Department, along with our community partners, you can still call in and schedule for a booster appointment as well. We're not having just a stand-up clinic operational for walk-ins. It's still going to be appointment-based at this time.
And hearing how low the case count is now, the daily case count, and how low the hospitalizations are, would that, in your opinion, do you think that will lead more people to think, okay, maybe since we seem to be in a good spot, I don't need to get a booster? So?
I think Dr. Ahmad made it really clear, especially about the second booster. I think the first booster, it's still imperative to get that. But for the second booster, understanding your risk as well as, your health status. So, an individual that's non-immunocompromised, that's over 50, in an area that's not surging but very low and continue to go low, is this the best time, or do they need to maybe wait and kind of monitor to see if I start seeing changes in hospitalization data, do I start reacting appropriately? But I think most importantly is a self-awareness of your health status. A lot of people say, I'm healthy, and they don't realize they have an underlying health condition. So, in this time where we've seen a decrease in COVID-19 cases, I hope people who may have not gone to see their primary care provider in a while take advantage to get themselves checked out, especially those who have maybe suffered from COVID. And we're seeing long hauler COVID and the impacts of it that has really changed your health status. So taking advantage of screenings, of preventative care in this time period is going to be really important.
Along the same line of Durante's question, I've heard people say that, oh, now we're hearing about a second booster for certain people. And they think that maybe the government is never going to stop telling us that we need another booster shot for some reason. So I think there's probably still a bit of frustration among some people. What would you say to them every time they hear that, oh, now we're talking about another booster shot, or we need to revaccinate or something like that?
So, well, the question regarding, all this information about boosters and additional vaccines, how does a general population take this? I think first and foremost, we communicate this at a general population level because we want to get information out as fast as possible. But we also have to recognize that our population, we have people that are healthy, optimal health, and we have individuals that have a variety of health conditions. It's a spectrum that we're on. And so understanding your own risk, awareness of your actual health status, not your perceived one, but an actual one. So again, getting those screenings done, preventative care, can help you have those conversations with your provider about what you should be doing. Because it's not just for COVID-19. It's looking at your Tdap vaccinations. It's looking at influenza, your hepatitis vaccine series. If you are 12 and older and a young adult, you are eligible for Gardasil. All of those things are things that you need to be aware of in terms of vaccination. I think there's been a lot of focus because we've been in a pandemic, and then we received a medical countermeasure for the first time, and we've been working through that. But vaccines have been in our wheelhouse for decades, and it's a reminder that they play an important role to keep our entire community safe.
We have the Easter holiday coming up, and of course more people are getting out to concerts, events, and things like that. Do you forecast a surge, and what do you recommend to people?
So regarding to the Easter holidays and concerts and other things coming up, we were very cautious about St. Patrick's Day because that's really just a few weeks before St. Patrick's Day when masking options started changing. And we monitored St. Patrick's Day, and we did not see an intensive surge. So I would still say your best bet is recognizing your risk, as well as if you are sick, please stay home, get tested, and then seek treatment accordingly. You don't want to spread COVID-19, you don't want to spread influenza, even norovirus, you don't want to spread. So, be cognizant of your own illness and make sure you're not sharing that with others.
If you could just generalize, like, how are we right now, just like the state of the Tri-County area in terms of COVID? Like, how would you say this?
I would say overall in the Tri-County, the general population can get back to normalized activities, recognizing that people will have different risks and will act accordingly, and we hope you respect their decisions to act accordingly. I think from a public health and healthcare standpoint, we're always going to be on alert. We're always going to be monitoring and watching surveillance. That's our jobs. And so we're going to continue watching this, and we'll update our public accordingly if we see issues that arise. But for the first time in, I would say, 2 years, I feel comfortable going into a grocery store without a mask on. So.
Some people that we have spoken to say that they've seen COVID symptoms without testing positive, and with using the home test kits, pretty much, I guess, questioning the reliability of the home test kits. What do you say to that?
I would say, you have to understand COVID-19, and part of the difficulty is it has so many similar symptoms to other respiratory viruses. So there is a likelihood that you're having symptoms and it's not attributed to COVID-19. We saw a huge surge in uptake in influenza recently. So it could be one and the same. But again, the best thing those individuals did was they stayed home and they got tested and they monitored their symptoms, and that's what we're asking people to do, is take on that individual responsibility.
And during the last presser, I think the one before that also, the word of the day was like pivoting. That's where we were. Is that still the word you use to describe it right now?
We are still pivoting. I think right now a lot of our weight is still looking at gearing up our surveillance systems, making sure we're monitoring appropriately, and then hopefully that's where we sit. Public health likes to be on a preventative and proactive space, not reactive. And so if we start seeing changes in the fall, we will react accordingly. But right now I think we're in a good place. Well, I will just end by highlighting one thing, which is today, actually this Monday started National Public Health Week. And so you asked a great question. Public health is still in this work. We're still responding, and we are still monitoring and trying to keep our community healthy and safe. And so again, I appreciate all the warm wishes that we received, and we are very lucky to be in a situation after 2 years that we are in today. So thank you. Have a good rest of your day.